Hello, this is Amy Tremblay, and we're going to do a little overview of Chapter 1, Community and Prevention-Oriented Population-Focused Practice, the foundation of specialization in public health. Our objectives are as follows. We're going to state the mission and core functions, describe specializations in public health, contrast clinical community health nursing practices, describe what is meant by the community. We're also going to name barriers that are to acceptance of community and prevention-oriented population practice, and we're going to stake key holder opportunities. So, renewed interest in public health and population focus in healthcare in the United States has happened over the past few years, and it's been because we have had a wonderful Affordable Care Act, which was enacted and hopefully will continue to help fund and create healthy population. We've turned healthcare to a population focus and a prevention emphasis. We need public health nursing. It's a very timely opportunity, and it's a challenge. It costs a lot. It changes very frequently with demographics and bioterrorism, and we are constantly trying to address epidemic preventions. So public health practice and the foundation of healthy populations, it's a solid history of preventative improvements. The Institute of Medicine report in 2012 had an emphasis on the funding for public health practices and an emphasis for population-based prevention. The Affordable Care Act gave us potential benefits for public health nursing. More people were insured. Public health agencies could shift from direct clinical services to more public health agencies and focus on community and population-focused promotion and prevention of diseases. This dramatic increase in life expectancies. Basically, what's happened is we've had a dramatic increase in life expectancies for Americans, and it's accredited primary improvements in sanitation, the control of infectious diseases through immunization, and other public health activities. The United States Public Health Service estimates that medical treatment can prevent up to 10% of all early deaths in the United States. However, population-focused public health approaches have the potential to prevent approximately 70% of early deaths in the United States through measures targeted to the factors that contribute to those deaths. Let's do a quick recall. How would public health nursing change if more people became insured? And so, if more people became insured, more screening would be required, community organizations would diminish, public health nursing would become more prevention-oriented, and case management would become a larger part of public health nursing. The answer is C. Screening frequently follows either surveillance or disease, and health event investigation is often preceded by outreach activities. So, get that? If more people had access to health insurance and thus health care, public health agencies could focus on community, population-focused prevention and promotion. Surveillance is often paired with disease and health event investigation, even though either can be implemented independently. Screening frequently follows either surveillance or disease and health event investigation, and is often preceded by outreach activities in order to maximize the number of those at risk who potentially get screened. Most often, screening leads to case finding, but this intervention can also be carried out independently. Public health in America? Well, if you look on figure 1.1, we have a vision. We want a healthy people in healthy communities. Our mission is to promote physical and mental health, prevent disease, prevent injury, prevent disability. Essential public health services are assessment, policy development, and assurance. Now, if you're a little uncertain about what some of these terms are, I highly encourage you to look them up in your glossary, and they'll let you know exactly what we're talking about. So, one goal of public health nursing is to focus most on tertiary health, primary health, population-based services, or clinical prevention services. And I would say that our answer is C. Screening frequently follows either investigation or impeded by outreach activities. So we're going to definitely be looking for population-based services. I would love to see that. Public health nursing aims to focus more on community, population-based promotion and prevention. It is mostly aimed at, often paired with disease and health investigation and prevention. So a core competencies of public health and professionals is analytic assessment, policy development, program planning, communication, cultural competency, community dimensions of practice, basic public health sciences, financial planning and management, and leadership systems and thinking. So we need to understand these principles of public health professionals. So the 3 tiers of core competencies are entry-level, management, supervisory responsibilities, and tier 3, senior managers and leaders in public health organizations. So we have some tier systems going on here, and you're going to want to look at that in your book. But tier 1 applies to entry-level public health professionals without management responsibilities. Tier 2 competencies are expected in those with management and or supervisory responsibilities, and Tier 3 is expected with senior managers and often leaders in public health organizations. So what exactly does that mean? It means that quality improvements in public health, we need to identify 8 curriculum content areas, we need to perform standards and accreditation processes. There's definitely things that we need to do to help provide for safe and progression of public health professionals. So definitely look at these competencies in tiers. Where do you lie? Are you a tier 1? Are you a tier 2? Are you tier 3? I am sometimes a tier 1 when I do my OB, but I'm also a tier 3 when I'm working with my advocacy groups, such as Planned Parenthood and the Alaska Nurses Association. So where are we? Curriculum content areas for public health accreditation. We need to know a lot. We need to know about informatics, genomics, cultural competency, community-based participation research, policy, law, global health, and ethics. So there's a lot going on here. The Institute of Medicine released a report, Who Will Kill the Public Healthy?, which identified 8 content areas in which public health workers should be educated and be able to address the emerging public health issues and advances in science and policy. So there's a lot here that a public health nurse needs to cover. And you know, you being wherever you are in your profession, you are a public health nurse in some way or another. So let's have a quick recall. Which categories or curriculum content are missing from this list? So the answer, of course, is cultural competence and global health. So this was just a little test to see where we were going. Screening frequently follows surveillance, disease events, investigation is often preceded by outreach activities. All right, so get that. Curriculum content areas for public health accreditation should include all of the following. We need to have all of that there. The National Public Health Performance Standard Program got 4 principles which we need to be looking at. They developed around 10 essential public health services, and we're going to see that wheel. We have a focus on overall public health systems rather than one single organization, describe an optimal level of performance, and support a process of quality improvement. If we have a breakdown in sanitation, how do we improve it? If we have a breakdown in herd immunity for vaccinations with hepatitis B in Fairbanks, how do we improve it? That's all part of public health. How are we going to improve these processes? Definitions of public health nursing. Public health nursing is the practice of promoting and protecting the health of populations using knowledge for nursing, social, and public health sciences. A public health specialty has the characteristics of an amazing nurse. She's got to be population focused, community oriented, health and preventative focused. She has to have interventions made at the community or population level. She needs to be in there with her peeps. She has to have, or he, concern for the health of all members of population community, particularly vulnerable subpopulations. And we have a lot of them. You guys are going to identify a lot of subpopulations as we go further on in this program and you start investigating your community. Subpopulations are simply, we could be disabled, we could have our homeless population, our maternal population, our immigrant population. There are a lot of different vulnerable populations. Our populations who are abused moms or abused kids, our drug addicted drugs, our mental health population. We can just go on populations. And some of our vulnerable populations can be something as simple as our elderly shut-ins. What's going on with them? So let's talk about essential areas of preparations for public health. And you're going to see it in box 1-3. And the essentials are epidemiology, biostatistics, nursing theory, management theory, change theory, economics, politics, public health administration, and history of public health. We have issues in public health administration, community assessment, program planning, evaluation, interventions at the aggregate level, and research. Woo! What are we going to be doing? Are we going to be doing all this in this class? I don't think so. But we are going to address some, but not all. Things that we really want to be honing in on is epidemiology, change theory. You want to be looking at public health administration, community assessment, program planning and evaluation, interventions at the aggregate level, and research. Research is key. We can't do anything without sound, solid research. And then education for public health, we want our current public health nurses need to have a bachelor's degree. And then we're going to do a public health population focus, which they're going to be focused in these special interests. And levels of public health practice. It's gotten different populations and different aggregates. So let's take a look at this little aggregate. The arrows denote the focus of an individual person or individual family in a subpopulation. For example, community-based nurse clinicians and nurse practitioners. The B arrows denote the subpopulation. The individuals are grouped into 3 separate subpopulations, each of which have a common characteristics. And then our A arrows denote the entire population, and the public health nursing specialists are usually concerned with more than one subpopulation and frequently with the health of the entire community. So as you see, you've got different aggregates that affect different things. So public health nursing is important. We're going to be looking at public health specialists and core public health functions assessment. Participate in and provide leadership for the following. You're going to assess a community needs, look at the trends in the health determinants, identify the priority health needs, determine the advocacy of existing resources within the community, and we're going to engage in policy development efforts. Probably not, but you guys are going to engage in promoting and advocating within the community, probably through social media. So public health specialists in core public health functions and policy development. I want you guys to kind of look through that, but we're not going to go too much into that right now. But you do need to know a little bit about that and do investigate your Healthy People 2020. So assurance. Assurance ensures that activities meet public health goals and plans, develop partnerships between public and private agencies, and they promote knowledge and behaviors. So I want you to kind of look at the rest of the PowerPoint. You have public health community nursing. There's this great areas for public health care practice, reasons to focus on free living clients, and then we have about 3 others. 2 major public health groups, 4 key areas for community health nursing, and challenges for the future. I think right here, let's just remember 4 key areas of community health nursing can be community-oriented, public health, community health, and community-based. And that is chapter 1. It's a little bit of an overview, but